Hello people, welcome to my channel The Physio Guide by Divya. Today I am going to teach part 2 video low back pain risk factors, clinical features and investigations I am going to cover. Now first you will see the risk factors. For whom this back pain mainly occur, more prone to back pain, include aged people, genetically it occurs, occupational hazard, lifestyle, weight, posture, pregnancy and smoking people are more high risk, and who are not prevalent also, they are at who do not have any risk also may come low back pain. Okay, there are special risk factors for low back pain that are for aging people. Aged people, they are more prone for getting this low back pain due to over wear and tear in the muscle, due to overuse, overdoing work. As a result, 30 to 40% are more prone than young people, and 30 to 60% are more having disc related disease, 60% are more having pain to the pain related to osteoarthritis, knee pain. Genetics also it may occur in certain types of spinal disorders like degenerative disc disease. It seems to be inherited, means one person to other in family it comes. Okay, this low back pain. Now secondary lifestyle, what are the risk factors? Means due to excess weight, poor posture, pregnancy, smoking, weight gain, occupational risk factors, mental health factors, back pain, overloading children due to lifting of more school books. Okay, these are the risk factors. Now we'll see the clinical features. Most patients have suffered from this low back pain in the lower area of the back at the lumbar and sacroiliac joints, and mobility impairment is seen, and patient can also radiate in the lower limbs. It will pass. Okay, now experience in this patient experience movement and coordination impairment. So in chronic patients it is difficult for standing, sitting, lying position also, and carrying things in the arm, bending may also more bending, carrying things also is the most complaint. Daily activities such as cleaning, sports and other recreational occupations can become a big task for people with chronic low back pain, so it will become more difficult for them. Now general, what are the normal symptoms, normal complaints this low back pain patients will give? Means pain, stiffness in the back, pain worsens, means increases during coughing and sneezing, tenderness, soreness, impairment spinal control, stabilization during functional activities, pain with contractions of muscle, decreased range of motion, means due to pain they are unable to do movements properly, pain in the buttock, legs, back, thigh, stiffness in back, pain relevant changes of position, when they change their position the pain will increases, pain swollen disc against. Okay, these are the problems. And neurological signs, symptoms, what are they? Means due to pressure against spinal cord or nerve root also may increase the low back pain, and due to myotome weakness and special dermatome sensory changes, radiating pain in the dermatomal pattern, degenerating joint is vulnerable to facet impairment. Next, facet joint pathology. Many people with this chronic pain have arthritis also, and due to symptoms what they complain to, or due to any fracture or injury also, nerve root compression at the C4 and C5. This is the main 95% of the disc prolapse takes place in this lumbar 4, L4 and L5 region only. Okay, next, investigation. Firstly we need to take an X-ray. If it is used to first imaginary technique used to look for any fractures or any vertebral malalignment. Okay, next, computerized CT scan we need to do. Computerized tomography. In CT scan soft tissue injury can be seen. In myelograms, in this procedure a contrast dye is injected into the spinal canal, allowing to observe spinal cord and nerve compression. If any nerve compression, it can be seen by myelogram, discography and MRI. It is used as a magnetic force. Instead it sends magnetic force instead of radiation to create a computer generated images. means that image can be seen. MRI scan produces images of soft tissues such as muscle, ligaments, tendons and blood vessels. Okay. Now bones can also need to do, if any. It is used to detect and monitor infections, if any bone infections, fractures or bone disorders. A small amount of radioactive material is injected into the bloodstream and will collect into the bones, particularly in areas with some abnormality. Okay. Now what are the clinical test examination, what we need to do. Next, forward bending, we need to tell them to bend forward to touch the toes. So observe if they are doing or not. Sitting and alternatingly extending one leg and then the other. Okay, sitting and lifting one leg or the other. Next is slump test. This is a test is based on stretching the sciatic nerve over the prolapsed disc. If any radiating pain, if any pain that radiates to leg passes through leg, this test need to be done. Extending one leg, next other leg. Okay. Next SLR test. Patient is in supine lying position. The examiner raises the leg of the patient straight one after the other up to 30 degrees. Nerve is not put under stretch. Between 30 to 70 degrees, nerves come into contact with the prolapsed disc and the patient complains of pain. Here in this position, the patient complains pain in 30 to 70 degrees position. Beyond 30 degrees, if patient complains pain, it is usually not due to disc. Okay, in this position, if the complains pain, this is due to this any compressed, any prolapsed disc pain. Patient in supine lying do SLR straight leg raising test till the patient get pain. Now lower the leg and do dorsiflexion. Here dorsiflexion front side. If the patient complains pain, then test is positive. Okay, understood. Next medical treatment, medical management, surgical management and physiotherapy management I am going to teach in the next video. So thank you for watching this video.